Hello everyone. As you know, my name is Richard Castro and I am your instructor for the Introduction to Electronic Health Records. Today we're going to go over the personal health record. I know it's a bit difficult to work as a team in this forum, but we will try our hardest to do so. First, I want to say hello to everyone. Danielle, Fawn, Joseph, George, Aline, Barbara, Pamela, William, John, Wehu, Ross, Matthew, Pamela, Sarah, Yolanda, Brian, Abel, and Brooke. So again, today we're going to study the personal health record. And after studying this chapter, you should be able to explain why consumers are being encouraged to take a more active role in their health record. List 5 tools that the personal health record offer that enable individuals to manage their health care. Explain the differences among the 4 types of personal health records. Explain the major advantage that a networked personal health record has over the other types of personal health records. Describe the 3 major barriers to the implementation of networked personal health records. What is a personal health record anyway? A personal health record is a comprehensive electronic version of a person's lifelong health. It is collected and maintained by the patient, who may or may not share it with his or her providers. I'm going to pause here for a few seconds while you read it and understand it a bit more. Why do consumers need personal health records? Not only do patients want to be able to access their own health records, but they should have access to their own medical records as well in a convenient and affordable way. So class, do you remember how medical records were accessed in the past? Well, one of your tasks this week is to send me an email explaining what patients in the past did to access their health records and what was the cost for them, say the 1980s or 90s. So send me that email and explain to me how they accessed their records and how much it was for them to do so. So what is the role of PHRs in managing health? One is the access of self-assessment tools. As a tool for consumer empowerment, the PHR must provide information that is useful to individuals caring for their health. However, it must be useful to the provider as well, because its value lies in shared information and shared decision making. Another valuable role of the PHR is that of renewing prescriptions. The patient can alert his or her physician that refills are necessary for their prescriptions. Today, prescriptions can be sent easily electronically to local or mail order pharmacies. It is no longer necessary to get written prescriptions for most drugs, and pharmacies are better able to fill electronic prescriptions without the worry of poor handwriting, drug dosing errors, and fraud. Patients are also able to set up alerts and reminders regarding appointments, tests, and other important health issues. For example, the patient sees a display or dashboard, much like their automobile's check engine light, indicating it is time to have a cholesterol test, an EKG, a pap smear, or other regularly scheduled test or exam. The dashboard is usually the main screen that the patient sees when logging into their patient portal. Class, can any of you come up with other ideas that can be placed on the patient's dashboard? Patients are able to track insurance claims, deductibles, and health savings accounts online on their PHR. Today's consumers are more conscientious about their insurance, copays, and deductibles, and FlexPay accounts more than ever before. With their PHR, they can track these things more easily than before when they link their insurance provider information with the PHR. Now, medical records is also a concern for today's consumers. The accuracy of their medical records and with their ability to enter things like allergies, their existing drug regimen, and medical history gives patients empowerment over their records. Have any of you ever found errors in your medical records and wonder how you can fix them? Well, now there is a solution to this problem. With the PHR, you can record data from home healthcare devices such as glucometers, pulse oxes, blood pressure cuffs, and other at-home devices. Here, patients can enter the data manually or sync their device with the PHR, and the dashboard will display warnings to the patient and perhaps even alert his or her physician that their disease process or other medications that control the disease process need adjustments. In the PHR, the patient can record symptoms, observations, and responses to medications. New drugs are always a cause of concern for patients. PHR is a perfect place for the patient to communicate the drug reactions that they observe to drugs. They can also record symptoms that they have in general, as well as observations and reactions to medications for their next visit to their doctor. Class, have you ever gone to the doctor to report your signs and symptoms and completely drawn a blank upon your arrival? Now we're going to cover types of PHRs. The first type is the computer-based standalone. Computer-based standalone, as it sounds, is from an individual's personal computer only. Software resides on the individual's computer and is entered by the individual. This type of PHR is not connected to any other computer or system and does not exchange any other information. Next is the internet-based or tethered. Information is stored and maintained on a website owned by an outside organization. The website is tethered, which means it is connected to the health information system or a particular organization. Some physician practices and insurance companies offer a patient a portal, and the website allows patients to communicate with them and view their EHR. Next is the internet-based or untethered. Here, the information stored on the website owned by the application provider. This is called the untethered and is not connected to any other health information system. So basically, all the information is entered and controlled by the individual. Many employers provide web-based PHRs to employees and often includes educational materials, self-help tools, and other similar items. Then there's the internet-based, networked, and interoperable PHR. This type of PHR, networked personnel health records, allow the transfer of information between multiple systems. For example, providers, insurance carriers, pharmacies, and patients can all access and share medical records on one system. After covering all four of these PHRs, which do you think is the most useful for patients and providers? The standalone, the untethered, the tethered, or the networked interoperable. So what you can do is send me a screenshot of the one that you think is the best and an explanation of why it's the best, and I will give you 5 bonus points for your screenshot and explanation. And here's a hint. Benefits of the networked interoperable PHR. It gives access to evidence-based health information, assessment of risk, enhanced communication with providers, empowerment of patients, increased patient safety, improved quality of care, improved emergency care, potential cost savings. Now we're going to cover lastly, the barriers of implementation. In addition to economic and technological challenges, organizational and behavioral issues that have delayed PHR adoption. Barriers exist both at the environmental level and at the level of individual healthcare professionals and consumers. The major barriers include interoperability, poor consumer awareness, and privacy and security. And that's the end of the presentation today. If you have any questions, please email me, come to my office hours, or call me if necessary. Thank you, and I'll see you next time.